So early menopause,
Right.
what defines it?
What defines early menopause is you have no periods for 12 months. We check your levels, and your hormone levels are low, and your follicle stimulating hormone is high. So which normally happens to someone when they go through menopause. But I see patients in their 30s. I have a patient as young as 31 who went through menopause. She had primary ovarian failure. All her hormone levels went into the tank, and she went through menopause as if she was 52 years old. I also have patients, Randy, who have a surgical menopause. They have their ovaries and uterus taken out for a variety of reasons, and they come in and they feel absolutely miserable. I mean, they literally are a shell of their former selves. I had a patient last month, 33, come into my office. She tested positive for a breast cancer gene, breast cancer right in her family. So the OB/GYN convinced her to have her uterus out, her ovaries out, and have her breast removed. And she immediately went into a tailspin. No libido, hot flashes, night sweats, irritability, couldn't sleep.
Okay.
Has a little girl, a new husband. These women are one of my favorite to take care of because
So that woman saw you.
that woman saw me.
How's she doing, by the way?
She's doing amazing. She is doing amazing because when you replenish their hormones, they're not that far removed from having very high hormone levels. Their receptors are still very receptive to those hormones. So we gave her estradiol, we gave her progesterone, we gave her testosterone, we gave her DHEA, and she's on thyroid. And she sent me an email. She said, Dr. Breen, you have changed my life. I finally feel like myself again.
So when you say amazing, what else? So she feels like herself. What, more energy?
She has more energy. She has her libido back. So when women lose estrogen, they get a lot of vaginal dryness. The vaginal mucosa dries up. Sex becomes very painful. So no more vaginal dryness. She has her libido back. She's sleeping way better. Her mood significantly improved. No irritability. And her energy levels are through the roof. That's very common in women who go through menopause.
How do they hear about you, by the way? Somebody, I mean, that's a...
What happens with her is she did not really get educated on what's going to happen after they take out your ovaries and uterus. They say, yeah, you'll have some hot flashes and night sweats. They don't talk about the increased risk of heart disease, the accelerated bone loss, and all these symptoms that they were going to have. She got online and did a Google search, and she found me online. And she said, you know what, Dr. Breen, I saw your video, I saw your infomercial. You look, I loved what you had to say. She came in, she had actually seen a couple doctors. They had dabbled with hormones. They actually put her on synthetic hormones. She was on Premature and Provera, which we know causes cancer. And I said, look, come in, we'll balance your hormones. I did an initial panel of blood work, which I do on all my women. She had no testosterone, no estradiol, no progesterone, no DHEA, or very low, deficient, or in the bottom end of the reference range. And all we had to do is replenish those hormone levels because she ate clean, she exercised, she was in shape, she was fit, she was always into aerobics and does yoga and eats very clean. All she needed is just to balance her hormones and it changed her life. So I see it's not the larger percentage of my patients, but I know there are women who are watching this right now who I am describing. They've gone through an early menopause. They've gone through...
I mean, 1 year without a menstrual cycle.
1 year without a menstrual cycle.
When should they do something? 3 months?
Immediately.
That seems like pretty dramatic.
So as soon as they realize they're in menopause, and there's ways to test if you're in menopause, there's blood tests that we can do to check if you're in menopause. That's when you need to get on it. Because the medical literature says the sooner you get on it, the better you feel, the better your long-term protection.
So they've what, lost hormones?
Yeah, they've lost all their hormones. It's as if their ovaries shut down. That's why they're symptomatic. So I love taking care of these patients, Randy, because they're out there. They're not the majority of patients, but we have patients. And I'll tell you, if you're going to have your hysterectomy, a partial hysterectomy, where they lose their uterus, but they leave in their ovaries, what they don't tell these patients is they actually will lose ovarian function because the collateral blood supply to the ovaries, they start to lose when they take out the uterus, and they stop producing as much progesterone, they stop producing as much testosterone. So even though they have their ovaries, they say, I have my ovaries, but I still feel bad. And the reason why they feel bad is because their ovaries aren't functioning optimally like they were before they had their partial hysterectomy. So there's a lot of women out there who we see who are being mismanaged because doctors aren't trained in how to give them progesterone.
Where do you learn all this stuff, by the way?
Well,
I know you're part of some pretty big organizations.
I spent a lot of money and invested a lot of my time in an organization called the American Academy of Anti-Aging. I received my board certification, Anti-Aging Functional Regenerative Medicine. I've studied with Dr. Rougier. This is my passion in life. This is, I believe, what I was put on earth to do.
Good.
I really, really enjoy this. So I was studied with the American Academy of Anti-Aging, which is the largest organization training physicians like myself.
There's like thousands of doctors,
Thousands of doctors from all over the world. We look at the science. We love the science. It's not that we are against drugs and surgery because I prescribe medicine. I certainly take medicine myself when I need it. But we know there's another way. We know there's another way to health and wellness. And just like patients are beginning to realize they don't have to accept the fact that they're going to decline in their health, their appearance, and their function. And science is evolving, and it's a very exciting time. Now, it takes medicine time to evolve, but there are a lot of doctors like myself who are doing phenomenal things with patients, and it's things that we were never taught in medical school. How to use herbs, how to balance hormones, how to do gut testing, how to look at adrenal function, how to do heavy metal testing. I mean, I don't think once in my medical school career someone came in with depression, did we say, what about arsenic and mercury? Well, you get toxicology classes, you look at environmental toxins. So it's a really exciting time in medicine. I love what I do.
So the results you're getting, like every week there's some kind of a story of somebody that felt terrible.
I have patient after patient after patient. The reason why I'm so passionate about this, the reason why I want to put these videos on my website, the reason why I put them on YouTube and get them out there is because I know there's women suffering. And it's just that there's not enough doctors trained like me who are giving them any answers. There's tons of amazing physicians out there.
Because insurance doesn't cover this.
Insurance,
right?
Unfortunately...
But it's not expensive, by the way.
It's not expensive.
It's less than a personal trainer.
Exactly. It's less than a personal trainer a month. I become their anti-aging or their hormone doctor. They all have... They can come in as often as they need to. They can call me. They can text me. They can email me. They can come into my office. It really, really is... I mean, I'm enjoying practicing medicine because I don't have to spend 8 minutes with a patient and go on to the next patient and just try and figure out how to...
You think you're making a difference?
I know. Oh, I'm making a difference, absolutely. And it's the reason why I'm so passionate about this is because I have stories just like I just told you about that 33-year-old girl whose life has changed. Her life is changed
you
because she feels better.
You couldn't practice medicine the other way?
I could not
like
go
working
back.
for some big healthcare where...
No,
where you're limited.
I need my own practice where I can look at the evidence and I can kind of practice how I want. It's very difficult.
It's all science-based.
It's all evidence-based medicine. I spend hours reading the medical literature. I spend hours on PubMed doing the research. What does it say about progesterone? So I put a lot of those articles on my website for patients to go on my website and read because it's important you educate yourself. You don't want to just go online and read a blog and all of a sudden change how you're practicing medicine. You want it to be science-based. So
tell me this, because at the top of this discussion was early menopause.
Right.
Okay. Which is, obviously I'm not a doctor, but it's hard to believe women will wait a year before seeing a doctor if they haven't had a menstrual cycle in a year. So at 3 months or 1 month, I mean, if they skip it for a month, 2 months, they need to do something.
Yeah, and they suffer.
But is it hard for you to get them early on?
They will see this. They become desperate at some point, and they will do anything to find you. So initially, you don't know what's going on. You want to check: is it something in their pituitary gland? Is there something medically that's causing this? Right? You rule out cancer. You rule out all these other things.
But along with
so they get worked
the fact
up.
that they don't have a menstrual cycle, they're usually what? No libido, bad memory, brain fog.
Hot flashes, night sweats, irritability. They're depressed. They're moody. They get vaginal dryness. Their libido's all over the
their
place.
hormones, take care of their nutrition. You're saying these
they
things...
feel amazing. And the reason why they feel more amazing at an earlier age than the patient who's 50 is because their receptors are so responsive. They get such a more dramatic result than even the hormonal menopausal women who still do great. But it's one of my favorite patient groups because they're the most grateful. They're the ones who send you the cards. They give you the hugs. They say, thank you, Dr. Breen, you changed my life. Those are the ones, that's why I'm making this video.
What about this, though? I mean, this comes up all the time, where they'll say, Randy, but my grandmother, she's healthy her whole life. She never took hormones. She lived to be 90 years old.
And
so what's your response? Do you think that woman, that grandmother, could have even felt better?
Right. Absolutely.
If she would have taken hormones?
It's all relative.
What's your belief, though?
Well, my belief is what the science says, which is when you have the hormone, you have the health benefit. When you lose the hormone, you lose the health benefit. So even though her grandmother had the genes to live to 90, could she have been sexually active through her 60s and 70s? Absolutely.
Good point. Okay.
Was she sexually active? No. Could she have the bone density that she has now? So a lot of women are 90, right? They're osteoporotic. They have a fracture.
So you believe they could have even had a fuller life? Like her grandmother could have had a much richer, energetic life?
More energy.
That's your belief?
Absolutely. It's not my belief. It's what we see. It's literally.
Okay.
I mean, there's nothing that says more than a life changed, right? So you can look at all the evidence in the world, and the evidence supports you, but there's nothing like when a patient says, you've changed my life. I can actually golf more. I'm actually having sex again. Sex is enjoyable. I'm sleeping better. I have more energy for my grandkids. We see this all the time. It's the reason why this field of medicine is exploding right now is because the internet and information age has allowed patients to share their stories. And when you share a story of a life changed, how could you not get up off your butt and change? And that's what we're seeing. So that's why we're here.
Good for you. If somebody wants to get started, they go to your website.
Go to our website.
They'll meet with you.
They'll meet with me. They'll call my office manager. She's our patient coordinator. She'll get them started. And within a week, they can sit down in front of me, and we sit down for 2 hours, and we talk about life and your health and your goals. And it is a lot of fun.
All right. I want to thank you for coming on the show. Always a pleasure.
Thank you.
You can watch The Wellness Hour. I'm Randy Alvarez. We'll be right back.